Hello, welcome to this session. I'm Fi Godlee, Editor-in-Chief of the BMJ, and I'm delighted to facilitate this important session on co-producing improvements in quality and experience, the why and the how. Recent years have seen growing interest and experience in the inclusion of patients and the public in care and quality improvement. And the four people on our panel today had intended to present a half day in Copenhagen full of inspiration on co-production. Since that time, they've all experienced how COVID has had a significant impact on their work. And we thought it could be helpful to encourage and share with others the insights, questions and challenges we are holding at this time. So let me first of all just introduce the panel who've created this session. We have David McNally from NHS England, NHS Improvement. Hi, David.
Hello.
We have Jane McGrath from WeCoproduce in England. Hello, Jane.
Hiya.
We have Vibeke Rischel from the Danish Society of Patient Safety. Hi there.
Hello, everyone.
And we have Cristin, a healthcare advocate based in Sweden. Hi, Cristin.
Hi there, everyone.
Before we start, we thought it'd be good to hear from you all about how COVID has affected the co-production in your life and work. And so we wondered if you could vote in the poll that is coming up now. How has COVID impacted on your work? Has it made it more or less difficult? So please do submit your vote. Yeah, am I allowed to vote? And by the magic of technology, we will hear, there we go. That, I think, is a very interesting result and one that perhaps we could have predicted. So COVID has made co-production more difficult and therefore this session all the more relevant. Thank you very much for that. So our panel members have each prepared a short summary of how COVID has impacted on their work and their lives. And they're going to each take a few minutes to share these, and then we'll come back together for a deeper discussion. If you want to share anything at all at any point, please do so on the chat. First up from our panel is David McNally from NHS England, NHS Improvement. Over to you, David.
Thank you, Fi. Hello, everybody. I'm delighted that we've got this opportunity to share our experience with you. In many ways, I think COVID's been a great leveller. It's obviously changed all of our lives, whether we're patients or people working in healthcare. I'd like to say a few things from both the work and as a paid professional and a more personal perspective, just to draw out some of the connections with those things and co-production. I think that the blurring of the home and work boundaries that's come about with remote working has been a real positive in so many ways. We see our kids walking in, we hear our dogs barking, pictures on the wall, people going for walks during calls. I think we've all got to know each other in quite different ways, and I think that's put us on really in many ways more of a level playing field. And those equal relationships for me are at the core of what co-production should be about. Many of us, of course, by this stage have had some more direct experience of COVID. And for me, that has been my 19-year-old daughter, who's a second-year medical student, who tested positive back in September, within weeks going back to university. Very fortunate she didn't get ill at all. She just lost her sense of smell. But as a parent, it was very stressful waiting around to see if she did get ill. And the thing that really stood out for me was just how supportive my colleagues were who I talked to about it. And I have to say that includes my co-presenters here. And my reflection is that that kind of mutual support is a key part of making co-production work. And I really like Tiffany Christensen's way of describing this, Tiffany from the Beryl Institute, when she talks about people with lived experience being considered and described as colleagues in just the same way as we would with our fellow professionals. And that leads me on to something else that has been really strongly reinforced for me in the last 7 months, and that's about showing appreciation. People I work with have told me just how important that has been for them during the pandemic, and in co-production, having to recognise, appreciate and reward the contribution that people with lived experience make is a critical part of how we go about what we do. Many people this morning, speakers this morning, have already made reference to the necessity of the changes that we've made and the speed at which we've been able to accelerate some of the things that we've been able to do. What we've been doing in England since wave one, so from the summer onwards really, has been reflecting on what we should keep doing and how we might go about implementing some of those changes. And that has created some opportunities for co-production that weren't there before. But I'm very conscious that that's not been the same for everybody. The poll really illustrates that, I think. And that's, I think, part of what we'd like to explore in the rest of our session. If we could just have the slide, please. There's just one example that I want to talk about that in terms of those opportunities. And we've been able nationally in England to co-produce a musculoskeletal strategy with people with lived experience. And we've been able to do that at pace. People often say co-production can't be done quickly, and it's not been in the too difficult box, which is often where people do put co-production. I don't have time to go through all of the points on this slide, but just to really tease out some of the key things for me. The national clinical leadership has been really, really key to this. We've had some clinical leaders who've been real advocates for working in this way. We've brought people with lived experience into paid roles to support other people with lived experience. And that's enabled us to bring in people with new voices, bring in a real diversity. And obviously working virtually has really helped some of those things. And we've really tried to identify and share the learning. And we've got a set of top tips, which we'll give you the link for just at the end. Last thing I want to say, I think leaders in healthcare really do have a choice about how we manage change or how we run our improvement work. I wonder in a way whether it's COVID that's made this more difficult or how we've responded to it. My experience tells me that it's possible, and I think that's a choice that we really between us. And that's all from me, Fi.
David, thank you so much. So that's showing the challenge, but also that we shouldn't make this something that we can put in the back burner. It's still incredibly important, and as you say, possible. Thank you very much for that. Over to you, Jane.
Thank you, and it's lovely to be here. Just by way of introduction, I'm Chief Exec of a small social enterprise that helps to deliver co-production between the NHS and the community. And I've been working all the way through COVID to continue to try to take some of that practice online. And I was reflecting on how COVID had impacted how I work and how I approach my work. And what was really key for me was understanding that as somebody who lives alone, that actually having to be on top of my mood and what was going on for me was really important about how and when I trod on into space that was about sharing power and trying to understand mutuality. So one of the things I did was to produce a map, which if we could just show that to the group. So I tried to map out this new landscape and this new territory. Just take a little while just to have a look. I really wanted to locate myself in this new kind of post-COVID world. And what I realized is that some days I loved being in splendid isolation. I was the sort of a wonderful recluse. I really enjoyed it. And at other days I found myself extremely frustrated and tearful and angry and full of all sorts of weird emotions. And it became really apparent to me that unless I was really aware of these, I couldn't go about doing my work as usual. It wasn't business as usual for me. So what was happening is I was beginning to think about how power is shared in relationships and also how and where I was standing when I was trying to negotiate that power. So really, I guess the point of this slide is really to say that if we are going to co-produce and we accept co-production as not an event, but a relationship that's ongoing and needs to be built over time, and relationships that will flux and ebb and flow, that we need to be constantly reflective in this new era about where we are. So really, co-production for me is a consensual process. It's a sharing and a relationship where we come together and need to learn and understand and respect each other in that space. So it's just a little bit of a thought for people as we move on. So thank you, Fiona.
Thank you very much, Jane. I love the map. The archipelago of Zooms is such a good one. And the, I don't know, planes of rolling news, very, very good. I'm sure people will want to reference that. Is that online somewhere, Jane?
You can, it's not, but we can have it to share with people if they want to.
I think you should tweet it. If you put it up on Twitter, Jane, people could then retweet it. I think it's excellent. Thank you so much for that. Vibeke, over to you.
Thank you so much. I have one slide, if you would put that up, Becky. Yes, thank you. So I'm Vibeke Rischel, as mentioned, and I'm the Deputy CEO of a small organization in Denmark, the Danish Society for Patient Safety, working to improve patient safety across Denmark. And we are an organization that are actually very premature, I would say, in co-production. On the other hand, I think we have moved the last 4 to 5 years, and the picture on the left-hand side of my slide was my workspace, pre-COVID workspace. It is a workshop with some volunteers from communities helping us to improve safety and quality in communities for elderly related to prevention of depression. And we did some really good work in this, and was about to embark even more on engaging with the civil society. And then COVID came, and my workplace totally changed from being together with people face to face, having real-time discussions, and to my workplace at home with my computer as a way to connect with people, and also having not having the interactions actually with patients or citizens to design co-production. So I think this has been a really for us difficult time on the issue of co-production, and I noticed that we are nearly 200, or we are more than 200 now, and 70% of you mentioned that this has been more difficult for you during the COVID. And I think, at least from my perspective, one of the things that has been difficult is that when we co-produce with patients, relatives, it's not people that we have a relationship with beforehand. And what we know now from virtual contact and so on is that it's difficult to make a relationship while you're on a virtual platform. So so I would say for our organization, a lot of this has gone into a non-existing thing, but I look forward to that we can bring it back to have conversations and workshops with service users and staff also. I'll leave that.
Thank you very much.
Thank you.
That's very, a real admission, which I think is so helpful to people to hear, that you found it really difficult, even with your immense commitment to doing this, that the virtual forums just don't make that easy to do, and you're sort of waiting for face-to-face to come back before you can really engage with it. So I think that's very helpful for people to hear, because they're probably feeling the same. Cristin, over to you.
Hi there, can you hear me?
Yep.
I'm not quite sure why, but my camera, that video image is me. So let's.
We can hear you, but yes.
Okay.
It looks like it's pointing at the ceiling, Cristin.
Yep. Okay. Got it. Thank you. All right. So I just want to, I'll introduce myself and say I'm Cristin Lind. I'm really sorry about why this camera is not working right now.
Don't worry, we can hear you now. Yeah.
Well, someone had to be the first. Okay. So my name is Cristin Lind, and I'm originally from the US, but I live in Sweden with my family, where I am today. And I really became passionate about co-production through my experience parenting my son. And he has a rare genetic condition that involves chronic health issues and physical and intellectual disabilities. For the past 10 years, I've been an advocate for better health and care through quality improvement. And one of the ways I do that is through this conference as part of the advisory committee. And today I wanted to share some of the ways that COVID has been creating some cognitive dissonance for me, which I think is affecting the work that I do. And if you could just share the image, that might give us all something to see.
I think they may not be able to hear. I'm just going to put here. Can you share?
Oh, here we go. That's
Yeah,
okay.
hold on.
Excellent. So just one second. So
I'll tell you just a bit of advice here, Cristin. Someone's saying it looks like your camera has switched to backward facing. That's the thought.
okay.
I don't know
going to, is everyone all right if we just...
Hi everyone, BMJ moderator here. Yeah, Cristin, your camera looked like it was maybe either turned around or picking up the wrong input.
Let me...
See if you've now turned it off, John. See if you pop it back on again, if it helps.
Oh, I was going to say hooray.
Oh, we've got you.
Give me 1 second, guys. Okay, here we go. Hi, yay.
Thanks, everyone.
Excellent. All right. So here's a slide that I think just kind of summarizes my experience during COVID. As I said, I'm in Sweden, and as many of you may have heard, the Swedish strategy has been quite different than in much of the rest of the world. There's been tremendous support for our chief epidemiologist, Anders Tegnell. As you can see his picture here in the top left corner, including people getting tattoos and embroidering his face to hang on their walls. And at the same time, I've also been receiving sort of contradictory information about COVID and what the right thing to do is from other sources that I also really trust, like the WHO and CDC. So what that has kind of resulted in is this first paradox or tension is one around truth and expertise and whether evidence-based medicine is really possible. And I know that that's a very dangerous space to be in when I walk into a co-production situation, but I think that it's important for me to acknowledge that I'm holding that tension. Another example is that I'm incredibly grateful for the work that the healthcare staff has been doing and trying to do all that I can to follow guidelines. And at the same time, I've been frightened and even angered when I've heard stories about family members not being included in critical healthcare decisions, or even examples of family members being barred or even arrested when they're trying to help their family. So there, I'm kind of experiencing a sense that perhaps being a trusted advisor, a part of the healthcare team, is something that's changing. And then lastly, healthcare communication. I'm seeing that I know that people are working really really diligently behind the scenes to send out good information. And what I'm seeing sometimes, and this is a poster here from my local primary healthcare center, is healthcare information that's kind of a bit more of a command and control style communication. And so I'm kind of left with the sense that of worry that we don't necessarily know how to do person-centered care when we're in acute situations, but also knowing that that's having an impact on outcomes. So I'm sharing all of this just to share, to let you know what's going on inside my mind and heart. And I knew that I needed to do something to address this as I step into co-production situations. I knew that I needed to do some inner work to, if not resolve these contradictions, then at least to be able to hold them in a way that was really productive. So the way that I started to do that was to begin doing some online sessions with my own network. We started out doing it weekly and have moved to monthly, where we are gathering to just simply listen to each other, to ask questions, to reflect and share, without kind of guiding each other, without trying to set each other straight, to just simply talk and listen. And I've put together some of the reflection questions that we have been asking about. If you want to advance that slide. And I I just offer them as an invitation for you to reflect on them, to maybe bring them back to your team or to your quality improvement partners, and just take a little bit of a moment to just reflect on what your own inner state is and to listen to what the inner state of others is before we kind of roll up our sleeves and get back to the work at hand, which is really important. So thank you.
Cristin, thank you very much for that. And it's useful, I think, to leave that slide up for a while, if that's all right. We're going to move into a sort of moderated discussion, which is going to be interesting to try and do in this format. But the first thing we thought we would do is just ask you, if you might, through the chat again, to write down sort of one challenge and one opportunity that you have experienced around co-production during COVID. Or if you've only found challenges, put down 2 challenges. But one of each would be ideal, and maybe you could start sharing those, and Cristin's list, we'll work around that for the discussion that's coming. So one challenge and one opportunity for co-production during your COVID months. It may take a little while to come up with some. Not being able to meet face to face. So it's been an opportunity to get young and digital savvy people involved. Engaging people virtually is challenging. Family visits to hospitals, that's been very difficult. They haven't been able to come in so quickly. Technology, both a challenge and an opportunity, I think we'd agree with that. Marginalised people, disadvantaged, are left out. And the senior leaders. Sorry, I missed that one. I thought that was great. I'll come back to it. Participating from home is helpful. Staff shortages due to illness. Easier without constraints of time and space, so more flexible. Patient engagement on standby because everyone was furloughed. These are all really great. Thank you very much. I'm going to ask the panel members to respond to any that you can pick out. David, why don't you pick out a couple of those that resonate with you?
So Rachel talked about the senior leaders wanting to move quickly and that leaving not a lot of time to do these things. I think that I just want to say a little bit more about the example that I used from our experience and why we had been able to do it quickly. And I think the thing that really made the biggest difference there was that the connections with people with lived experience to bring them in were all done by somebody with lived experience. We had a real connector kind of approach to it, which was really effective. So she was able to find people quickly. And I think because of her credibility, that enabled us to bring people in, and people were willing to join and participate from an early stage. I'm not suggesting that's the complete answer to it, but I think for some, I think sometimes we just need to be quite clear that that if we are committed to co-production, that involves what it involves, and even if it does take a little longer to do it, then that becomes absolutely necessary. I think I get a general sense as we've moved on that the urgency is not there in quite the same way. So I know one of the things we've said a lot in England going into wave 2 has been, well, we've a lot of the learning that we had from wave 1 means we don't have to reinvent those processes. So we ought to have more opportunities at this point, certainly, than we had at an earlier point. Just the other one I'd pick up, which was actually from which Mary Ryan mentioned earlier, actually, was about funding for involvement activities being not being available in this period. And I find that quite shocking in many ways. That I've always been of the view, and it's something we pushed through all the work we've been doing over the last 7 months is that actually the money that is necessary to bring people in to these processes should be an integral part of the budget for the way we do the work. So if we're genuinely committed to co-production, then it's not a separate pot of money. It's if we're doing a large scale change project or any kind of improvement work, that funding should be an integral part of the funding that's available for that work. I recognise that it isn't, but I think it should be.
Thank you very much, David. Jane, your thoughts on the answers we're getting on the chat?
Yeah, I was really interested in the idea of kind of the technology and using sort of younger people and more tech savvy people in our work. It's definitely something that we had to do. So one of the things that happened for us over lockdown was that we started a radio station, and it's an online radio station that pretty much does what we try to do in situ in community spaces. And we sent out recording kits to people's houses. We trained people up, and we were able to reach out we had Fatboy Slim's tour manager was on furlough, and he came in and helped us. We worked with 2 technicians in Serbia. We worked with people in New Zealand, a guy in Venezuela. And we basically came together to create a new medium for us to be able to reach out, particularly to those who were shielding. So I think that would never have happened without COVID. It may have in some form, but it kind of really put sort of a set of fireworks under what we were doing. So I just wanted to say that it can be a wonderful opportunity. The other thing that did happen is that for us, at least, the NHS kind of closed down, and they're our biggest client. So we just had to get on with doing stuff without them. And I think that was a shame, because I think that we could have brought a lot more using technology into those spaces and help make some of the decisions which were difficult about closing services a little bit more palatable, perhaps in the way they were communicated. So I'll leave that there.
Thanks very much, Jane. Lots of appreciation for your radio idea on the chat. Vibeke, thoughts on these responses?
Yes, thank you, Fiona. I think one of the things that strikes me is the opportunity of patients to be part of the sort of macro design of the system. And I see some of the comments is also related to, for instance, family being able to visit elderly in hospitals, nursing homes, and so on. And I think one of my thoughts has especially been around the if we have some crisis standard of care. We don't have that in Denmark, but I'm pretty sure we will have that for the next pandemic to show up. And how can we include the voice of patients and not only the voice of professionals when we decide on what should be, for instance, the access to have a visit during COVID? What should be the way that we would design healthcare? I think some of the challenges that lies within just closing down without actually asking patients what would you prefer, and I think so some of the opportunities mentioned here, as Jane just mentioned, with technology. I think there was one of the comments here saying that's both a challenge but also an opportunity, and I think we should really see now co-production as the opportunity for taking this to the next level. Looking down at the comments, I'm also struck by actually people from different parts of the globe having similar challenges. So I think we're really in a situation of co-production that could be even more global than local. Yeah, I think that would be my reflections back to the comments from the audience.
Thank you, Vibeke. Very, very good. Cristin, what do you feel is coming through here? And maybe another of the questions in your slide you might like to reiterate to feed back in.
Sure. Well, I'm thinking about, I'm seeing a lot of opportunities that people are sharing around the move to digital spaces, and that's definitely something I'm experiencing in my own work. One of the projects that I'm working on that we started before COVID was coming up with an event for Karolinska Institute for the end of a 5-year research project, and that was intended to be a small group live event with a very small number of core team members reflecting on what had been learned, and now that event has shifted and been moved online, and we're expecting 100 people, including many patient research partners and people who typically wouldn't be able to participate in an event like that. And I think that what I'm seeing, though, in this kind of as we do this move, and what I've heard a little bit of other folks sharing as well, is that it's not necessarily just about moving from what would have been a live experience, a live meeting, to a digital or virtual format. That it requires a certain amount of forethought and planning. Just looking at my own, what happened with my own experience around technology, or how we're presenting. How long can people listen? A day-long event is not always really possible for most people to do on Zoom anymore. So as a facilitator, I'm thinking a lot more about how are we doing this? How are we creating a container where co-production can really happen? How do we create a situation where people can really say what will help drive innovation? So not just having lots of lots of people in the space, but that we can actually have qualitative conversations. And so one of the questions that we've been exploring a lot is one of my favorites here is, how are you creating welcome for others and yourself? So when I think about, what am I doing in my own physical workspace and in the way that I'm working now to welcome myself to fully show up? And when I'm inviting other people in to collaborate with me, how am I extending welcome to them? How am I making sure that they get a chance to speak? And how do I know that I'm really listening? So I think technology is offering us some amazing opportunities, and I think that it's also requiring us to really step up our game in terms of facilitation as well. I'm going to be really curious to hear what people have to say about that.
Thank you so much, Cristin. I love the idea of welcoming yourself to fully show up. I think we don't have to wear anything vaguely decent except on our up top half, and so we can sort of shamble from meeting to meeting and not shower very often and all those things. I'm hopefully joking, but there's an element of actually still there is preparedness and centeredness and all of those things that make sure one is actually present in these meetings. I also am conscious of the listening function and how Zoom, in a way, as opposed to just being on the telephone, should help with that sense of showing people that you're listening. I personally find that very helpful, and I find the Zoom is quite a leveler because everyone is on the same spaces. But I think the need to keep in mind the vulnerable, the people who aren't so technically savvy, and how they could easily get left out of the conversations is absolutely crucial. I wondered if we might put back to you all to tell us about where you see co-production emerging in new places and new ways. That idea of the radio station is obviously, people seem to be very thrilled with that. Whether you in your own lines of work, I'm talking to the delegates here rather than the panel, have ideas about where new ways of co-production seem to be emerging, and perhaps you could see if you can share some of those with us in the next few minutes. And then the other thing that we were wondering about was, sorry, let me just get my list of questions up. How could they be built on? How could any of the opportunities for co-production that the pandemic has created which is this sort of really rapid shift to technology solutions. How could that be built upon to really bring us into a new era of partnership with patients and service users and their families? So we're hoping that you might send us some thoughts on those things.
Fi, just while people,
I'm very struck. Oh, David, you go. Yes.
I was going to say, while people are doing that, I just wanted to build on Cristin's point, and it partly for me goes back to Vibeke's point earlier about the idea. Face-to-face clearly has a lot of advantages over the virtual, but it seems to me things are probably never going to be the same again, even however long this pandemic lasts. So I think for me the key thing in what Cristin said is we really need to find ways to make this work, and we've had a lot of conversations recently about how we've lost a lot of the social aspect in the way we do online things. So we just, we start a meeting at a certain time, and so even where we're working with people with lived experience, what we recognised after a period is we just start a meeting and it had a formality about it, and that I think we've really got to find ways to do that welcoming in a very proactive way. And so, for example, one of the things that we did on a recent session with a group of people with lived experience was we opened the room up a lot earlier. So we opened the room up 30 minutes earlier and told people we were doing that. And we were quite explicit that was intended to emulate the arriving at the event and getting your cup of coffee and your biscuit, and then the chat that went on around that. And it worked almost like magic, because the how comfortable people felt then in participating when we did have the conversation was evidently much greater the case, and people fed that back. And the other thing that we've done is actually have in a longer event is have a very early breakout session, so that people have an opportunity, even if they didn't get a chance to join in the early bit, they get a chance to talk to other people. And just, I think there are some things that we can begin to build in that just bring back in some of that relationship building aspect of it that Jane talked about earlier. And I think we've all talked about how we got really good at using the technology. I think we need to be more reflective and think, how can we get better at it that really makes it work to its maximum in terms of those relationships?
Very helpful, David. And we've got Katrine Kirk saying that in Deloitte they schedule meetings to include 10 to 15 minutes of check-in with small talk and coffee pouring. So that's something I think people can absolutely learn, and Nicola Davey agreeing about that. There's talk about near me, a video consulting service that enables people to have health at times and when it's convenient for them. The walk and talk is also an idea you can test. Vibeke, maybe tell us a bit more about that.
Yeah, the walk and talk. I think first of all, I think one of the things most of us experience during COVID is actually that being on online meetings, whether it's Zoom or Teams, it's quite exhausting. So what we have been testing is to do a walk and talk like we would do if we had a workshop. We might say to a group there, please have a chat for 15 minutes. And what I've been testing is sending out the asking people to connect on their phone, and said, for the two of you, you can have half an hour to have a conversation, but we also recommend you do it as a walk and talk, so you can walk from your home half an hour and have a conversation with another person. And first, I must say I was a little skeptic, but it seems that it's we can connect like we would used to, even though we might use if you don't use FaceTime, just regular call. It's worth doing.
Thank you, Vibeke. I wonder, we've only got a few more minutes, whether Cristin, you have, so we've had David's idea of the coffee bringing in slowly, and there's Vibeke's walk and talk. Cristin, top tips for achieving, well, I suppose it's partly all of it's well-being for ourselves, but also ways of encouraging co-production.
Well, I mean, in addition to some of the techniques that they've talked about, I've actually been opening meetings with a poem or a piece of artwork. I think, for example, Jane, your map, as a way of just kind of sort of stepping back into getting a bigger view. That's one thing. I think maybe now as well, it might be time for us to just admit that it's time to start picking up the phone and like calling each other again, one-on-one. That, you know, that we may not get a chance to have lunch together, or I guess maybe, as David said, is just kind of accept that this is the way it's going to be for a while. And rather than, you know, apologizing for it, just start doing the reach out, start checking in with each other. I know that wasn't easy for me during the first few months, and it's important for me to sort of remind myself that, you know, I'm not going back to the way that things were in February anytime soon, and I need to figure out the new, you know, what's my strategy going to be now. And I think that what I'm going to be entering into more is reaching out with my network, with my colleagues, rather than trying to schedule big group meetings, but just reaching out to people one-to-one and just listening to what life is like for them right now. Brilliant. And maybe that's something we can do for some of our patient partners as well.
Thank you very much, Cristin. Brilliant. Jane, your top tips. We've had the radio and the map.
Well, music is our medicine, you know, and one of the ways that we found to open up a meeting is actually to put some really great, we had Barry White on the other day, and people started dancing. You know, so sometimes if you just kind of shake it up a little bit and sort of people aren't expecting it, get the toes tapping, that's one way of just changing that energy. But just carrying on also from what Cristin said, one thing I noticed about myself is that I tended to do more emails at work and more phone calls with my friends. And I sort of somehow shied away from calling people and moved more into that typey space. So I think actually that's quite nice if we start to reoccupy the telephone call and start to connect with our voices. So I think that was a good tip from Cristin.
Fantastic. Well, look, we're going to have to close. If you have any questions, you know, as we close, please do put those into the chat, and we can. I'm sure that the panel will come back to you. And as Vibeke has said, do link up on the conference platform for further conversations. Really, just to say thank you to the panel for creating this session and for reminding us of the importance of co-creation, co-production, something that the BMJ is intensely committed to. We have a patient partnership program and really try to have patients involved in the creation of all of our content. So I really think this is a very important session to remind us that COVID or not COVID, we have to continue this very important trend towards partnership with patients and putting patients in the centre. So thank you so much for being with us. Just a reminder that we have a few resources to share, and please continue the conversation on the conference platform, as I've said. A couple of upcoming sessions that might interest you. Today, November the 2nd, we have a patient service user and carer meetup, which is session N2, N for November 1, N1. And on Tuesday, co-production and beyond, patients lead the way, rapid fire videos. That's sessions B for Bravo 4. And then on Wednesday, patient-centric research during the pandemic, keeping the wheels turning, a live workshop. That's sessions C7. Thank you very much again for being with us and for your wonderful participation on the chat. Keep in touch through the week, and I hope you have a wonderful time. Thank you very much.
Thank you.
Bye.
Thank you.
You guys, that was